Welcome back to the module 3, that is blood sugar monitoring. Here, this graph shows the blood sugar fluctuations throughout the day in response to the meals that you eat, right? So the one over here, the y-axis represents the blood sugar levels, that is mg per dl, and the x-axis over here, it marks the different meal times, that is your breakfast, lunch, dinner, and bedtime snack. So before the meals, right, that is you have to target that your blood sugar level should be between 80 to 130 mg per dl. Okay, it has to stay within this range. That is before your meals. After your meals, always try to target less than 180 mg per dl. The blood sugar level, often it spikes like after each meal. That could be your breakfast, lunch, dinner, or the bedtime snack. This indicates that there is a post-meal glucose increase. The spike should remain below 180 mg per dl because this is the recommended range. And the bedtime should be, your target should be between 100 to 140 mg per dl. Blood sugar seems to stabilize the dose to this range because before your bedtime you need to have this particular range, that is between the 100 to 140 mg per dl. A slight rise could actually indicate that a bedtime snack or a gradual glucose regulation is, there could be a dysregulation if there is a spike during that time. So please make sure that you keep your range between the mentioned ratios. This infographic over here provides information about the essential diabetes test and how to interpret the blood sugar levels and A1C levels. So, what is this different types of test, right? The 4 top tests for diabetes includes the A1C test, the HbA1c test, then you have the random blood sugar test, okay, right? And then you have your fasting blood sugar, that is nothing but your FBS test, the oral glucose tolerance test, OGTT, and there are other different types of tests. So this HbA1c is something that is going to measure your average blood sugar over like 2 to 3 months. The random blood sugar test is nothing but it is going to measure your blood sugar at any time without fasting. Fasting blood sugar, as the name suggests, it measures your blood sugar after an overnight fast. It could be like 8 hours of fast. Oral glucose tolerance test, here what happens is it is going to measure the blood sugar before and after consuming the glucose, like to assess how well the body processes the sugar. So these are the different types of test, right? So what is HbA1c? A1c is nothing but it measures your average blood sugar levels like over the past 2 to 3 months. So here is the classification. If your HbA1c is less than 5.7%, it is normal. If it is in the range of 5.7 to 6.4, you are at a risk of pre-diabetic state. 6.5 to 7, diabetic. If you are at the range of like 7.5 to 8, you need to monitor closely. 8.5 to 10, you need an action because that there could be chance that your blood sugars have been high like for almost 3 months consistently. 10.5 plus is really a serious issue, right? So these are the interpretations for the A1C. Coming to the blood sugar levels, if it is less than 125, it's normal. If it is in the range of 126 to 139, it could be a pre-diabetic state. And these are random blood sugar tests, right? And if it is like 140 to 168, it could be diabetic condition, but you need to confirm with other tests like HbA1c and other OGTT, etc. This is just an interpretation. If it is 169 to 196, then you need to monitor closely. If it is 197 to 254, action is needed here. 255 plus, definitely immediate action needed. It could be a serious issue, right? So this is just the interpretation of the HbA1c and the random blood sugar levels. How does this HbA1c work? So what happens is this, as we know, HbA1c is going to help you to check the average blood sugar levels for over the past 2 to 3 months, right? So the first step here, sugar sticks to your red blood cells. So what happens when you eat, right? The sugar enters your blood. The sugar is going to stick to your red blood cells, right? And then what happens? It stays for about like 3 months there. And we know that red blood cells live for almost like around 120 days. That is nearly to 4 months, right? So since sugar stays attached to them, doctors can measure your past blood sugar levels, like which is your past 2 to 3 months as well. A simple blood test measures it. Like how it happens is a small blood sample is taken, a finger prick or any kind of a lab test. Okay, the test is going to show that how much of percentage of sugar coated the blood cells. Higher numbers mean that there could be a chance of higher sugar levels, which could indicate diabetes or pre-diabetes. And why do you think it's very important to take, HbA1c? Because there is no fasting needed. You can take this test like anytime. Second, shows like long-term sugar control. It helps you to understand that what your diabetic condition is in a better way. Helps in early diagnosis, definitely, because high HbA1c means you may need a lifestyle change. So these are some of the points that you need to consider when you have to take an HbA1c. How do you monitor your blood sugars at home, right? A blood sugar monitor helps you to check the blood sugar levels at home. It's very like easy to use. You need to just follow these steps. First, you need to insert the test strip. This is the test strip over here. Take a test strip and insert it into your blood sugar monitor, which is also called a glucometer. Take the blood sample. Like you need to use a very small device that's called a lancet. This particular thing to prick your fingertip, and I don't think so it is going to cause like a lot of pain. It's just a small prick, like a mosquito bite. And then you get a tiny drop of blood here, and then apply the blood to the strip. Gently you need to touch the blood drop to the test strip, right here you can see. And then you get the results. The monitor is going to show that your blood sugar levels on the screen in like just a few seconds. And in case you're still confused, I would advise you to go on and consult a physician. Just do it for the first time with them. And there are other videos as well on YouTube, like if you want to refer and do it. But the first 2 times, I would say, please go to a physician and then get to know that how to use a glucometer, and then you can do it at home. When you check your blood sugar levels using a glucometer, your results typically fall into these of 3 categories. That is the normal category, right? The impaired glucose and the diabetic. So let's try to understand. In the normal range here, your fasting should be between 80 to 100. After eating, it should be 170 to 200. 2 to 3 hours after eating, it could be 120 to 140. These are the reinterpretation. These are the results that you need to understand and correlate them. Reference values, I would say. Impaired glucose, if your fasting, the levels are 101 to 125, it could be impaired. After eating, if it is 190 to 230, impaired. 2 to 3 hours after eating, it is 140 to 116. Between them, then you have a impaired glucose levels. And in case your fasting is like more than 125 or 126 plus, then there could be a chance that you have a diabetic condition. After eating, if it is 220 to 300, definitely diabetes. 2 to 3 hours after eating, if it's 200 plus, diabetes. So these are some of the reference value that is already been provided. So whenever you check your blood sugar level using a glucometer, you can refer to these values. But definitely the lifestyle modifications such as balanced diet, regular exercise can prevent the progression to diabetes, because this could be a chance of pre-diabetes state, the impaired glucose, right? The red zone here is characterized by the high sugar levels, and it could be because of the diabetic condition. The diabetes control chart here helps us to monitor the blood sugar levels and understand the diabetes management, right? Here what happens is, here it is trying to categorize the blood sugar levels into like different ranges, you can see. That is based on the HbA1c percentage, which reflects the average blood sugar level, which we have already seen in our previous slides. Then green zone indicates the excellent control here. That includes your, the HbA1c, which is falling between like 4 to 6%. Your blood sugar ranging from 50 to 115 mg per dl, suggesting a well-managed diabetes with a minimal risk of the complications. The yellow zone over here, it represents good control. That includes like the HbA1c between 7 to 8 percentage, and blood sugar levels like between 150 to 180, which indicates like improved, slightly high, but it can be manageable sugar levels, like improved diet and exercise. The red zone over here, this is like where you need your action, right? Action is suggested in this condition. That includes like HbA1c levels between 9 to 14%, and blood sugar levels are going to be from 215 to 380 mg per dl here. And this indicates poorly controlled diabetes, and also like an increased risk of complications such as your nerve damages, kidney disease, heart problems, etc. So if blood sugar levels fall within the green zone, maintaining the current habit is recommended. For those who are in the yellow zone, I would say like lifestyle adjustment can actually help them in better control. However, individuals who are in the red zone should definitely seek medical attention immediately to prevent the further health risk.